some incredible stories that really bring these issues to life in the lives of the people that I represent. And so again, I just want to say thank you for joining us here today. You know, you'd be hard pressed to find a Minnesotan today who hasn't had someone who had healthcare insurance deny them the care that their doctor had prescribed. This has become ubiquitous across this country with a number of insurers. And the truth is, for too long, these mega health insurance companies have raked in record profits while exploiting sick Americans. Well, my team and I have listened, and we say enough is enough. And that's why last month I introduced my Patient Refunds for Bad Denials Act to hold healthcare companies accountable for sky-high denial rates and to work to put money back into Minnesotans' pockets. My bill would create financial penalties for health insurers that deny more than 25% of claims in any given year. Think about that. More than 25% is how this bill is written. Can you imagine a health insurance company denying 25% of the care that your physician says that you need? That fine would total $10 million plus an additional $2 million for each percentage point above that 25% denial threshold. Suffice it to say that the health insurance companies aren't very happy with me today, and I'm just fine with that. Because as it turns out, I represent the same people that they are supposed to serve. More importantly, these penalties that we are asking in this bill, health insurance companies to pay when they deny in excess of 25%, these penalties would be paid directly back to affected patients, which means less money for healthcare executives and more money for all of you. Now, I don't have to tell the people in this room how broken our healthcare system is. You're living it every day. But it's important to be crystal clear about what needs to change. There's no doubt that insurance companies are one of the major culprits of rising healthcare costs, and the American people are fed up. According to a recent poll by the Kaiser Family Foundation, 2/3 of uninsured adults believe delays and denials of health insurance claims are a major problem. And 1/3 say they have had a health insurance company deny coverage for a service or medication prescribed by their doctor in the last 2 years. Even worse, nearly 40% of participants who reported having trouble paying medical bills said that denied claims contributed to their medical debt. That's unacceptable. We live in the richest country in the world. Americans shouldn't be struggling to pay for necessary health care, especially when they're paying an arm and a leg already for health insurance. So that's why we're here today, to talk about the path forward toward a healthcare system that actually works for Minnesotans, and how we're going to work together to hold these players accountable. With that, I want to thank you all for being here today, and I want to get started with our discussion. So let's just start perhaps with a brief introduction, and we'll start with Trent. You'll just tell your name and who you represent, and then we're going to get into some dialogue after that.
Good morning, everyone. Congresswoman, thank you to you and your team for hosting this important dialogue. My name is Trent Anderson, and I'm the state director with Protect Our Care, Minnesota.
And I'm Representative Robert Bierman. I'm currently serving in the co-chair role of the Health Finance and Policy Committee at the state legislature from Apple Valley. And I too really appreciate the time and the invites here today, Congressman Craig, and all the work you're doing. Thank you. This is a spot on topic, really good.
Thank you. And Bob.
I'm Bob Miller. I live in Prior Lake, and I live with MS. I was diagnosed in 2004, and so I've been involved with Representative Craig on a few of these roundtable topic issues about healthcare and pricing, and glad to be here.
Thank you, Bob. And last but certainly not least, and with a really heartbreaking story that illustrates why we're here today, Dan, I'm going to ask you to introduce yourself, but I can't wait to get back to your story.
Yes, thank you, Congressman. My name is Daniel Smano, and it's my wife, Her name is Nicola Smano. It's spelled Nicholas without the S. I'm representing her. She's 53 years old. She was diagnosed with Alzheimer's disease. I'm here to represent her as far as struggles we have with the insurance problems.
Thank you, Dan, we really appreciate it. And I want to say thank you to all of the advocates who are in our audience today as well. Thank you for being here. We really appreciate it. And, you know, I may even do something that we didn't plan and open it up for any questions to the panel that you all would have, you know, before we're done as well. So thank you so much. Let's start with Representative Bierman. Robert, thank you so much for being here today, and thank you for your leadership in the State House. I want you to start off by talking a little bit about your work at the state legislature. What reforms are you working on at the state level, and in particular around the high cost of healthcare and insurance in the health?
Sure. There's a lot of